Let's talk about visual diagnosis, the tongue structures and functions. The tongue inspection is a unique and important diagnostic method in TCM. It is used to observe the abnormal changes in the tongue body and coating in order to analyze and diagnose disease. The tongue is a large bundle of muscles on the floor of the mouth that manipulates food for chewing and swallowing. It is a key organ of taste, and as the surface of the tongue is covered in taste buds, the tongue also assists in forming the sounds of speech. The structures and the functions of the tongue and its anatomical structure. The tongue is a muscular organ in the mouth which is covered by a mucous membrane. It extends from the hyoid bone at the back of the mouth upward and forward to the lips. Its upper surface borders and the anterior part of the lower surface are free. Elsewhere, it is attached to the floor of the mouth. The intrinsic muscle fibers, which run vertically, transversely, and longitudinally, allow great range of movement. The upper surface is covered with small projections called papillae, which give it a rough texture. The color of the tongue is usually pink-red, but can be discolored by various diseases, which makes it an excellent indicator of health. The lingual papillae. There are many papillae on the tongue surface. According to their shape, size, and distribution, papillae can be divided into 4 categories. The filiform papillae, the most numerous and smallest papillae on the tongue, distributed over the tongue tip, body, and sides. The fungiform papillae, mostly seen on the tip of the tongue and scattered among the filiform papillae. Newborn babies have more fungiform papillae than adults. Circumvallate papillae, the largest papillae, 7 to 9 in number, arranged in a V-shaped distribution anterior to the sulcus terminalis, which separates the tongue body from the tongue root. The foliate papillae, 3 to 6 in number. These papillae are found only in small percentage of the general population and are considered a remnant of past evolutionary stages. The functions of the tongue include differentiating tastes, mixing food, chewing and swallowing, modulating the voice, like speaking. Wait lang. Here's the tongue anatomical structure. The muscles include the muscle fibers that travel in 3 directions, vertically, transversely, and longitudinally. And the blood vessels enter the tongue muscle, which is pink to slightly red color. Also includes the membranes, the filiform papillae, fungiform papillae which has thin, white, and moist coating, and the circumvallate papillae and foliate papillae has a taste and sense. Thank you for your attention.